This series has been brought to you by Lawrence Public Library and the League of Women Voters of Lawrence and Douglas County. And we've had topics like the census, engaging with your neighbors, with the precinct committee chair people, and a look at local government setup in Lawrence and Douglas County. And today we've got a very special guest. We are going to be talking about expanding KanCare across Kansas. And we have, we're very lucky to be joined by April Holman, who's the executive director of Alliance for a Healthy Kansas. And April's here and she's going to be giving a presentation. And then if you have any questions, you can use our Q&A function, which should be at the bottom of your screen. If you have any issues with that, just use your chat and we can do Q&A at the end of the presentation. So thank you so much, April, and we'll look forward to your presentation.
Great, thank you so much for having me. I'm going to go ahead and do my screen share. Let's see. Awesome. Well, again, I'm April Holman with the Alliance for a Healthy Kansas. We work almost exclusively on advocacy around Medicaid expansion. So we are, there we go. The Alliance is a nonpartisan, nonprofit initiative, again, centered around Medicaid expansion. We would love for a time very soon to be working on other issues of access to affordable health care. But unfortunately in Kansas, we've been stuck on this particular policy for several years now. So the Alliance works on through policy education with the public and with policymakers, legislative advocacy, and organizing. And we have a coalition of more than 100 organizations statewide who have all come together from a variety of different perspectives to advocate for Medicaid expansion. Actually, we have just gotten up to 121 organizations. And then we have a network of thousands of individuals across the state who are personally brought to the point of wanting to advocate for expansion. In some cases, those are people who personally are impacted or would have new access to health insurance if we did expand Medicaid eligibility in Kansas. Some of those people are moved by their faith to advocate for this. Others are from business or, many other walks of life and just realize that this is an opportunity that would really benefit our state. So what is Medicaid expansion? Way back about 10 years ago, when the Affordable Care Act was passed, there was originally this continuum of assistance for people to get access to health insurance. And so that started with the people who were at the very lowest income. And those people would receive Medicaid, and then it went all the way up to people who were at 400% of the federal poverty line. In the course of a variety of litigation against the Affordable Care Act, the portion that made Medicaid expansion that made that something that states had to do was struck down. And so it is now an optional component. And so far, many states have opted in, but Kansas has not been one of them. The earliest that we could have started Medicaid expansion is in 2014. So this map gives you a little bit more of an idea of what I was talking about with that continuum of assistance. On the left side of the umbrella, the red part that says Medicaid, that is for people who are at the very lowest end of the income spectrum. In Kansas, it doesn't matter how little you earn. If you are a childless adult, our Medicaid program does not cover you. So in Kansas, the only individuals, adults who are eligible for Medicaid are people who have a child under the age of 18 in their homes. And so they can earn up to 38% of the federal poverty line, which is pretty bare bones, even compared to some of our a variety of other states have much more generous Medicaid programs. Then on the right side of the umbrella, you'll see the marketplace subsidies. These are what you usually hear about when in reference to the Affordable Care Act. So there are subsidies that people can qualify for through the tax system, and you sign up on healthcare.gov and can get a variety of different estimates of how much it would cost you to insure yourself in a private policy. The catch is that that only kicks in at 100% of the federal poverty line. So that's a little bit of a throwback to the original legislation being a continuum. And when that middle portion was struck down, they were not able to fix. There are a number of little glitches like this, and there hasn't been the consensus to be able to go back in and make adjustments to the Affordable Care Act. And one of the casualties is that that whole group of people, for instance, in Kansas, who are, if they're childless adults, starting at 0 income, but those others who do have a child under the age of 18 at 38%, all the way up to 100%, there's no coverage and no assistance through this federal government program. So it's very strange. Sometimes people will go, they'll know that they should qualify for some sort of assistance on healthcare.gov. They'll go into the system, put in their income and all of the information, and they'll receive back extremely high estimates for how much they would have to pay. And to, if you just stop the analysis there, you think that this, the Affordable Care Act is pretty useless. And I think that that's really where the whole idea of the coverage gap plays in. A lot of people who have had that experience are actually, they are in the Affordable Care coverage gap and they don't realize it. So that's our job at the Alliance, to help people understand that and to help people understand that there is a very simple fix to provide an umbrella that covers people, again, all the way from the very lowest income up into 400% of the federal poverty line with access to affordable health care. These are the Medicaid / Affordable Care Act guidelines. Medicaid is eligibility is based on household income. And so there is, it changes quite a bit based on household size. So just to give you a little bit of an idea, that 38% of the federal poverty line, if we're talking about a family of 3, maybe a mom with 2 children, she is already making too much money if she makes $8,255 a year. So you can see that that is a very, very low amount. And then the other side of that gap for that same mom is $21,720. So she is not going to qualify for any assistance with healthcare coverage until she reaches that income level that then helps her to qualify for the subsidy through healthcare.gov. This map shows you the kind of the lay of the land with states that have already opted in. you'll see that Kansas is one of the dark blue holdout states. There are 12 states left, and we are an island in the middle of our area. So all of our neighboring states have now adopted Medicaid expansion. Colorado was an early adopter. They've been, experiencing the benefits of Medicaid expansion for quite some time now. And Nebraska passed theirs, back in 2018 in a ballot initiative. And it's just now going into effect. They took quite a bit of time to get all of the components of their program put in place, but people are enrolling right now. And then Oklahoma and Missouri have both passed Medicaid expansion just within the last few months through ballot initiatives in those states. Now, in Kansas, unfortunately, we don't have the option in our Constitution for ballot, for initiative and referendum. So going that route is not going to be possible here. We do have to go through the legislative process in order to make Medicaid expansion happen. But you can kind of get an idea of how pervasive Medicaid expansion is. Sometimes we hear people talk about Congress stepping back from expansion, but you can see that there are both red and blue states that have benefited from Medicaid expansion now, and we've reached critical mass with this. So actually back in 2017, when there was a big effort to undo the Affordable Care Act, it was governors from all of the states in light blue, or at least the ones who had adopted expansion at that time, who were some of the most vocal voices saying that they did not want to see the Affordable Care Act and particularly Medicaid expansion undone, because of all of the important ways that it had helped their state. One of the things that we hear very often is that in states like Ohio that had a particularly difficult time with the opioid epidemic, that Medicaid expansion was one of the tools that has been most helpful for them in battling that. So there are a lot of different benefits from Medicaid expansion. And one of the things that, one of the only benefits for Kansas being one of the last states to do this is that we have research from states who have already passed showing what the impacts are. So that research has found that there is a greater access to care, decreased uncompensated care costs. So for hospitals and other providers, they are more financially stable because they don't have the high levels of uncompensated care that they might experience in a state like Kansas, where there is no Medicaid expansion. There's reduced medical debt for individual consumers, which is huge. You probably know that the leading cause of bankruptcy in our country and in Kansas is medical debt. So I think that not only does it help that individual consumer to access care, but it also helps their family financial stability. There's an increased utilization of care in states that have expanded and increased coverage. There are also a number of financial implications for states that have that expand. So for instance, Kansas is estimated to forfeit about $1.8 million every day that expansion isn't in place. And so to date, the state has forfeited almost, it's actually a little bit over $4.3 billion in federal funding by not expanding. So when you think about that, Kansas taxpayers are paying federal taxes just like taxpayers in any other state. But in Kansas and 11 other states, we're not seeing that benefit of having the dollars come back to our state in the form of Medicaid expansion. And it's really to the detriment not only of our consumers, but also our state economy and providers in the state. So one of the things that I didn't mention earlier, and I should have, is that the way that this works, it's an incentive that the federal government has provided for states to expand, and they pay 90% of the cost of covering people in the expansion population. So there was, in the early years, a phase in. So it started out at 100% that the federal government paid, and then it went down to 97%. We are now in the fully phased in portion, so we will never go lower than 90%. That 90% match from the federal government, unless there's some sort of act of Congress to change that. We know that there are a variety of creative ways that states have paid for the 10% portion that the state's responsible for. Last year, the hospitals in Kansas offered, or they proposed, a hospital surcharge that would have generated up to $35 million a year to pay for Medicaid expansion. I don't know if that's going to be the case in future proposals, but we know that in last year's proposal, it greatly reduced the cost of expansion to the state, so that it was only going to cost about $2 million in the first full year. We know that Kansas has experienced a really dramatic economic downturn as a result of the COVID-19 pandemic. We know that Medicaid expansion is anticipated to increase jobs by about 13,400. And so I think that is, one of those ancillary benefits that expansion could have, in that it would be by bringing in all of those federal dollars into the Kansas economy and creating new jobs in the healthcare sector. But then there's a ripple effect, so it can help to increase jobs in other industries as well. So those that, service and other areas that might be impacted by the ripple effect of the healthcare spending. That's really a pretty painless way for us to kickstart our economic recovery. We also know that expansion would really facilitate a healthy workforce. As we look at people who have lost their jobs due to layoffs and the downturn in the economy, many people have lost their employer-sponsored health insurance as well. So in some cases, Medicaid expansion would help them to have the coverage that they need to stay healthy and then be ready to be part of driving our economic growth back to where we were before, and hopefully beyond where we were before. I think another thing that we look at as advocates is the impact of Kansas being kind of that island in our region. It's going to make it more difficult for Kansas communities, particularly rural communities, to be able to attract new businesses if they are not able to maintain the healthcare infrastructure that's really needed to be a vibrant community. We know that with the communities just on the other side of every border around our state, having that ability to provide expanded Medicaid eligibility, that really puts us at a disadvantage, not only for attracting and retaining healthcare talent, but also on an overall economic development basis as well. In Kansas, we have a huge problem with rural hospitals in particular who are struggling to be financially sound. There are a lot of reasons for that. Medicaid expansion is not the only thing that's needed in order to shore up that system. But we know that Medicaid expansion is a really important part of the solution. As a matter of fact, there's been some research that has been done with states, kind of comparing states that have already expanded and those like Kansas that have not. And if you are in a non-expansion state, rural hospitals are 6 times more likely to go under than they would be in a state that has expanded. So sometimes we hear that there's really not a difference that expansion could make in shoring up the hospitals in rural areas, and the evidence just simply does not support that. We know that it makes a big difference. Again, it's not the only answer, but it's certainly an important answer. We also know that, again, in states like Ohio that have done quite a bit of research about the impact of Medicaid expansion, they found that people who, in their expansion population, actually had improved their employment status and prospects because they were healthier and they were able to address behavioral health issues that might arise, or physical and mental health issues that could be a barrier to employment. We know that if people have healthcare coverage or insurance, they're going to be less likely to delay care because they can't afford it. And, you know, when people delay their care, not only does it become more expensive because often it becomes more acute and people have to go to an emergency room, it also ends up being more difficult for those people to recover. So there's really not a lot of good that comes from delaying care. So just a little bit about the history of Medicaid expansion in Kansas. The Alliance was formed in 2016, and in 2017, there was legislation that actually passed both the House and the Senate that would have enacted Medicaid expansion, but it was vetoed by Governor Brownback, who was the governor at the time. There was an attempt to override the veto, and we came very close to overriding it. We fell 3 votes short in the House. Then in 2018, there was really no real movement on expansion legislation. And that was, you know, kind of the same experience that happened in 2019 as well. Governor Kelly was elected in 2018. As advocates, we were very excited to have a governor in place who supported expansion, because we knew if we were able to get it through the House and the Senate, she would sign the bill. Unfortunately, even though the House was able to get Medicaid expansion legislation passed, the Senate refused to act. And then this year, we started out with a lot of hope because there was a bipartisan agreement between Governor Kelly and Senate Majority Leader Denning on Medicaid expansion, and that really didn't get very far either. So the pandemic hit, there was opposition also by people who had really tried to tie Medicaid expansion to a constitutional amendment on abortion, I think as a way to get political leverage, to get more votes for that constitutional amendment. And so we find ourselves once again working on Medicaid expansion at a time when, you know, definitely the pandemic has created even more need for access to affordable health care, and that health coverage for people who otherwise would not have access to insurance. And we know that the need, there are about 150,000 people that had been anticipated to benefit from Medicaid expansion prior to the pandemic. We know that number is higher now, but we're still waiting for updated figures from the state. So I've heard that it could be as much as 175,000 people, but until we get those new numbers, we're really just kind of guessing at this point. But the bottom line is, I think that most of us really have realized, even if we didn't before, that the health of our neighbors and the health of our community as a whole is really important to us personally, to our families, and to the well-being of our state and community. So I would say that for me, as an advocate that's been working on this for a few years, and with colleagues who have been working on it even longer, it just is an imperative that we get this passed next year, because there are so many people that absolutely need this. And I think that the state also needs to see the influx of those federal dollars to help us in a time of need. With that, I am, always eager to answer any questions that you have. I'd like to point out that we have a website at www.expandkancare.com. We have a lot of fact sheets and information there for people who might be interested. If you are interested in following the progress of Medicaid expansion legislation next year, or in advocating for that, you can text KANCARE to the number 52886 to sign up for text messages. And I would also welcome you to follow us on Twitter or Facebook, and that information is on the screen. So with that, I will stop and see if there are any questions.
Thank you. That was wonderful. I'm looking down because I am texting KanCare to that number right now.
Oh, great. Maybe I should have left my screen up longer.
I will be able to share this out in the event link, and the presentation has been recorded, so we will be able to share that out as well. So yes, and you get a text immediately right back. So that's wonderful. We let's see, we've got our first question. Okay. They asked, do you have a citation for any health outcome studies, hopefully using the pre and post implementation? Let's see. So kind of financial for individual and health providers. Any like concrete studies about what happens financially before and after implementation, or is that something that may be on your website? Some research.
So I just want to, I know that it's hard to clarify so are we talking about the financial impact to the individual or to the state?
Looks like it says financial for individual and health providers.
For the individual. I think that there have been studies, and I have found a lot of success with the Kaiser Family Foundation. They've done quite a bit. I'm trying to think of the best way. I don't have a citation off the top of my head, and I'm trying to think if I provide that to you at a later time, is that something that you would be able to post? Or maybe I could just ask our communications director to post something on our website so people could find that.
If you wanted to do that, we can share it from the library, or if you send me something, I can also put it in the YouTube link as well. So and for whoever asked, you're welcome to follow up with the library. Okay, so it says the question was to eliminate financial, but to ask for health outcomes.
Financial, I'm sorry. I think I need to, let's see this because I'm, eliminate financial, but to ask for health outcomes. So, I mean, I think that there definitely has been quite a bit of research that has been done about the individual impact, financial impact in Ohio. So some states have done a better job of trying to get do the research to follow up. I'll do some checking, and we'll post it on our website at expandkancare.com, and then I'll also send it to you, Kate, so that you can do whatever you need to. So I'm sorry that I don't have that citation off the top of my head, but I really believe that there's something out there that is exactly what you're looking for.
In a similar vein, sort of, do you know if there have been more bankruptcies in Kansas and in other holdout states than in the states that have adopted? You said that that medical debt is the leading cause of bankruptcy, and so I'm wondering, and I'm willing to look this up too, but if there's any correlation between bankruptcy numbers and expansion.
You guys ask really good questions. So I believe that there is. So that's something that, certainly when you have, like, if bankruptcy is the leading cause or if medical debt is the leading cause for bankruptcy and you're reducing that, I think that it all kind of goes that there would be fewer bankruptcies, but I don't know that off the top of my head. And so, again, that's something that I'm going to need to look up. I started my career working for the Kansas Legislative Research Department. And so I never really want to say something that I can't back up with data.
Yeah.
Which I don't think that all of the people on the other side of this argument have those same scruples, and it puts us at a little bit of an advantage. But I want to make sure that I'm giving you guys the right information. So I think that that's something that I will try to get for you as well.
I will put my email address in this person who's asking these great questions, and see if we can kind of get them connected to a more detailed answer. So this is kind of just a clarification question that I had. Okay, so without expanding, we have, like, as Kansans, we have paid 4.3 billion or more in federal taxes that has gone nowhere.
Well,
it's got not for nowhere for our state.
Right. It's going to other states. So it's paying for, consumers in Colorado to get access to care, which I think it's always great when consumers get access to care. But I'd really like to see that happening here closer to home than see Kansas tax, the tax dollars from Kansans going to help people in other states and not here.
Yeah. And that feels like something that is especially an especially good argument for the bipartisan aspect of it, just because I feel like we all kind of want to fight for our own people, and if there's that much money that's going in other states, we want it to stay here.
Yeah. Could I just follow up? So I probably didn't focus on this as much as I should have, but this is really a bipartisan issue in Kansas. This is not, it is true that at least since I've been working on this, every Democrat in the legislature has supported Medicaid expansion, but we've had a lot of Republicans that have supported it too. Even people who we would see as maybe more conservative, but who are from communities that would really benefit from this, especially in rural areas. We've seen a lot of support for expansion. And when we've had polling, there have been probably 5 or 6 polls over the last 5 years about support for Medicaid expansion. And it's always very clearly an issue that is supported by people in the state. So I think the average of all of the polls is about 62% in favor of expansion.
So what, let's see, I'm going to repost some links for some more information. So we've got, let's see, expandkancare.com. I'll be typing this out and sending it to everybody right now. And then also looking up Alliance for a Healthy Kansas on the social media networks like Facebook and things.
Do you need those, or do you have?
Well, so Zoom doesn't really let you have clickable links. So if, as long as people are searching, searching their networks there. So let's just say once we do implement the expansion in the nearest future possible, how long does it take to take effect then?
It really depends on how complicated it is. So there have been a number of states that have needed to get special waivers approved by the federal government in order to implement certain parts of their Medicaid expansion. So I'll give you an example. It's been pretty popular in more conservative states to try to do a work requirement. Arkansas is the only state that was successful in putting it in place for any amount of time. But that would require a waiver. So that could take, it could take years to get the federal government to get it all the way through that waiver process. I would just say, as an aside, the work requirement has been enjoined by most of the courts in most states that have tried to do it. There's no state right now that has a Medicaid expansion work requirement in place. And one of the reasons, one of the things that we saw in Arkansas when they had it, they had it live for about 6 months. And there were thousands and thousands of people who lost their Medicaid coverage during that time. And in some cases, it was people who were in the middle of cancer treatment and they lost their coverage because they weren't able, in some cases, people weren't working. Because they were ill. In some cases, they were working the required number of hours, but they were having trouble jumping through all of the hoops to document that. And in other cases, there were people who were maybe falling just short because, we know that if you're in the Medicaid expansion income range, often you're working hourly jobs and you don't have a lot of control over the number of hours that you're scheduled. So you might be, working 20 hours one week and then the next week, the restaurant might be slow and they send you home before you meet those 20 hours. Well, it's difficult for people to be able to then work the number of hours needed in order to get their insurance. So that's an example of when it might take a little bit longer. But if Kansas were to do just a straight Medicaid expansion, we've heard from the Department of Health and Environment that it would probably take somewhere between 6 months and a year to get all of the rules and regulations and everything up in place to get it implemented.
Okay. And so we've got an attendee who asked, as far as like the work requirement goes, that would definitely have an impact on retirees and people who are on disability then too, if they are unable to work or retired.
Yeah, so I just want to clarify something about the Medicaid expansion population. So Medicaid expansion is an increase in eligibility for adults between the age of basically 19 and 64. So people, young people qualify for the Children's Health Insurance I don't know why I said that, program up until they're 18. And then, so this would kick in after that. And then on the other end, you qualify for Medicare starting at age 65. So this really isn't necessarily something that impacts seniors. This is really just the health insurance part of the Medicaid program. So not some of the other things like home and community-based services that you would see, maybe for seniors.
Okay. And let's see. we have room for some more questions if anybody has any. This has been really wonderful information. I bet a question that we all share is, what can we do as concerned citizens?
I never know how much with the different groups, how much I can talk about that. And the Alliance is definitely, we are a 501c3 nonprofit, nonpartisan entity. So I'm not going to say anything about the elections, even though, I think it's important for people to be engaged. And, but I think that, there are lots and lots of opportunities leading up to the legislative session for people to be involved. I think there's a lot of power in sharing your support for Medicaid expansion with elected officials. And I think that, we're always looking for ways that we can make this more real for the public and for elected officials. So if there are people who personally fall inside, fall in the coverage gap and, have stories that they're willing to share about that, we're very interested in hearing from you. Again, I think that it's really easy for people who maybe, I think a lot of our legislators are a little bit older, and the way that you get health insurance has just changed so dramatically, even over the last 20 years. When I first started working, pretty much everybody got insurance through their employer, and they paid for most of it. Sometimes if you wanted to get like a really, great plan, you had to pay a little bit more, but that is definitely not the case any longer. And I think that there are a lot of people who just don't understand what those realities are. So anytime we can talk through the situation that people find themselves in who are in the coverage gap. And the more people understand that these are hardworking people, people who are, it's not for a lack of doing anything particular that people find themselves in that situation. It's just that the environment has changed and we need to change along with it. So yes, stories and advocacy being part of our network is something that we're always looking to expand that and bring more people into that, because I think there's so much power with grassroots advocacy, and that's really the only way that we're going to get this passed in Kansas, is if there's a very loud voice in urging lawmakers to do it.
And so since this is about civic engagement, we are a very huge fan of that. So when, if someone wanted to be an individual member, a supporter, is that's something you just would sign up for on the website? And
yes, you can sign up on our website. I am absolutely happy to have you email me personally. So my email is April, APRAL, at expandkancare.com. And you can also just find my email address on the website. So if you're having trouble figuring out how to sign up to be part of our network, just send me an email and I will make sure that happens.
Great. And so when is the legislative session?
So our legislature starts the second week in January. I think I should know this off the top of my head, but I'm drawing a blank. I think it's the 13th maybe of January. So it's the 11th of January.
Okay. So can those of us, again, as individuals, is like letter writing, is that an important thing, or is there do you have any other kind of concrete tips for getting involved besides sharing the stories and
yes.
things like that?
So I definitely think social media is something that's getting more and more attention from elected officials. So many of them have their own social media, which you can pretty easily search. I think that letter writing is still, a really important way to get a hold of people. Letters, emails, phone calls, all of that is important. And I think it's really interesting at the state level, there's probably more impact from those letters, emails, and phone calls than you would think. So, especially when we look at the House of Representatives where they have smaller districts, if a legislator hears from 10 people on the same issue in a week, that is a huge hot button issue for them. So it's really important to do that. I think that, it's good to have relationships with elected officials maybe before they go to Topeka in January. So if you're able to, meet them either whether there's like a town hall or some other gathering, now a lot of that's virtual, but there's still ways to get to know people before they leave, and maybe it's just as easy as dropping them a note before they go, before you have a really strong ask for them, because people are, it's human nature to be more responsive if you know somebody. So again, sometimes that can happen even if you share a little bit about yourself, like I'm your neighbor, we attend the same church, our kids went to school together. If there are ways that your life has kind of intersected with the elected official, I think those are all very helpful ways to get their attention and get their attention for your issue. In this case, Medicaid expansion.
Yeah, I think that since this is such a, compared to a national issue, this is such a local sort of thing, we've got a lot more voice than we maybe realize, or a lot more power than we maybe realize to be able to connect with our officials. So that's wonderful. I have learned so much. Thank you so much. We've got time for another question if anybody has any. We've also, in the chat, we've got both of our email addresses and the website you can go to. And then we've got some really nice kind of testimonials from some of y'all to look at about your own perspective on the issue. And I think that for those of us who do not fall within that gap, making sure we use our privilege to speak up on behalf of others is really important. So showing that that's something that we all care about, whether or not we are personally impacted or not. So
Absolutely.
Yeah. Well, thank you. Yeah.
I want to thank you so much. I really appreciate the opportunity to share what's happening with Medicaid expansion. We're always so happy when people are interested in this and when they become passionate advocates. It's very exciting. So if there's anything that we can do to help you be more informed about it, or to share the same kind of information with other groups, I absolutely welcome that. And again, my email is april@expandkancare.com. I would love to hear from you.
Thank you. And yeah, if anybody has any questions, someone suggested these would be good for neighborhood associations, these sorts of presentations. So yeah, if you've got access to those groups, like I said, this video will be on YouTube, or this presentation will be on YouTube. So you're welcome to share this, do a presentation of what you've learned. You can find facts and fact sheets on the expandkancare.com website, or reach out about kind of doing another one of these engagement presentations. So thank
Absolutely.
you very much, and hope you all have a wonderful evening.
Great. Thank you.
Thank you.